competition with more insurance companies, and you have individual contracting with insurance companies over what they want to purchase, you can have those companies looking at controlling costs through the best practices. The problem is when you have the comparative effectiveness in this type of an arrangement like what we see with the federal government, you have people that are removed from the people because you take away the sovereign choice of the consumer. Under this plan, there is no out. Government says this is the plan that you have to go with. Whether government tells private insurance companies they have to follow this model, or whether it's a government plan, it's still government calling the tune. I like the idea of the consumer calling the tune. That the consumer says what they want to have in the health insurance plan that they get. So I'm not against any of those that way of looking at medicine through the Comparative Effectiveness Council. But the thing is, what does a person do if they're in a one-size-fits-all system and the decision comes down, sorry Charlie, you're out. Where does the consumer go to get the health care they need? And I think all of us agree we want people that have access to health care, and I just don't think this is the best option. So Christine, thank you.
Okay, Mike on the right.
Congresswoman Bachmann, I'm just grateful that I'm here and have an opportunity to speak with you. I live in Blaine. My name's Trent.
Why don't you speak in the mic? Speak in the mic.
Can you hear me now?
Better. Make sure you use the mic.
Okay. I'm from Blaine, Minnesota. I actually went to Lincoln Elementary School in Anoka, Fred Moore Junior High, and Anoka High School. So I'm a graduate of Anoka. I've been a public school teacher at Soderberg Elementary School in the Anoka-Hennepin District for 20 years. I'm a 4th grade teacher. I'm very passionate about my job. I'm grateful that I have the insurance that I do. I don't take it for granted. I'm just very appreciative, and I don't take my job for granted either. You know, I'm not a racist. I'm not a right-wing extremist, yet I have conservative Christian values. And again, I'm just, you know, your run-of-the-mill middle-class type guy. But here's my question, and I'm sure some people will say, geez, this guy's a nut. He's this, he's that, and I'm not. My concern is after this 4 years with the current administration, or possibly a second term of 8 years, I have concerns that, to be frank, that they may not leave the White House. I believe that they, whether by force, brute force, I knew I would hear this, or just by a fraudulent but I tie this into freedom, because with this healthcare program goes our very freedom, and if people can't see that, then I'm sorry. But so my concern, and you may not be able to answer this now, and I understand, but just think about it, just about the danger of, quite honestly, this administration not leaving power.
I think I got your question. Thank you. Thank you for coming out today. Thank you for being here. As a fellow Anoka grad, I think I'm a lot older than you are. I'm class of 74, but thank you for what you do as a teacher. That is my concern too, freedom. Number one, that's what this country is founded on, is freedom. And I'm very concerned about the federal government coming in and taking over 18% of the private economy. Because an economist from Arizona State University had an article just a couple of weeks ago that said this: since the inception of Bailout Nation last fall, September, October, since the inception of Bailout Nation, absolutely, I disagree with you. This was under George Bush, and I voted against the bill because I don't agree with the $700 billion bailout. So this is a bipartisan effort in terms of Bailout Nation, and I oppose Bailout Nation. Since the inception of Bailout Nation, we have seen 30% of private business profits today owned or controlled by the federal government. If we go down this grow and have the federal government take over another 18% of the private economy, just realize we're looking at 48% of private business profits owned and controlled by the federal government. That's not the direction that's going to lead us to opportunity and growth and prosperity. And that's my concern.
Mike, right here.
Yes, thank you very much. My name is Mike Robinson. I'm from Stillwater, and I would like to go back to your assertion that we have the best health care in the world. I believe that the 18% that you mentioned is 4, 5, or 6% above the industrialized nation's percentage of GDP that they spend, and from many measures, including life expectancy, we have worse outcomes. We're more highly medicated. We have more illness, and I think the use of the term health care is a misnomer. This is illness management. We're paying much too much for our illness management. We need to cut the cost and get back to good health care, including bike trails. Okay, that's my health care program, riding my bike. Thank you very much.
Mike, thank you for coming out. Thank you for sharing that. No, let's hold our time together.
Okay, here we go.
The difference is, I want to make sure, Mike, that you have the opportunity to buy the type of health care that you want. If you don't want the illness management in the way that it's currently done, I want you to have that opportunity. For instance, some people do well by acupuncture. Some people do well by alternative forms of medicine.
Your assertion of the best health care, you're not addressing the question.
Okay, so
the best health care is not being addressed.
okay, Mike said that he wants me to address the issue of the best health care in the world. You and I disagree. I believe we have the best health care in the world. The type and quantity of health care that we want. No matter what type of health care it is, I want every possible option available. So we can disagree about what the best is, but I'll tell you what, I would far prefer to have American medical care than I would health care in the UK any day of the week. Before I let Dr. Burgess make his point. I just printed out before I came. These are just some headlines from the UK, the United Kingdom. This is just half of the staff. Headlines about the disaster that is the government takeover of healthcare in the UK. You probably heard about this story day before yesterday. It says the babies are being born in hospital corridors. There's a bed shortage that's forced 4,000 mothers in the UK to give birth in elevators, offices, not here. And I'll tell you what, I've given birth here probably more times than you, sir. I've given birth. I've given birth in the Stillwater Hospital, and I'll tell you, it is the finest care you could ever receive. And
multiple academic medical centers around the country. You see people coming from all over the world, to come to our centers, our Mayo Clinic, our MD Anderson, our Southwestern Medical Center. This country going to France and England to get the medical experience. And I would also add, America is so fortunate to have such a large number of dedicated men and women who are willing to put their lives on the line. While we debate the relative value of their efforts, they still show up to work every single day. And we need to be mindful of the fact that our words have consequences in their lives as well. So for any of you doctors and nurses out there, thank you for the job that you do.